You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me. I'm now well into my series on how to improve your oral and overall health. And in the last episode, we talked about your home care regime, and we started touching upon what you can do to have a healthy mouth for a healthy life. We spent a lot of time focusing on brushing and flossing, and today we're going to move beyond that to add in some extras that you can use to really improve your oral health, because your oral health impacts not only on your teeth, mouth and gums and on your smile, but also on your overall health. There's a systemic link to dental disease, and dental disease can impact your heart health, increase your risk for things like dementia, Alzheimer's, types of cancer, diabetes, stroke, heart attacks. So it's really important not only to keep your mouth healthy to keep your teeth, but to keep your mouth healthy to keep you healthy. So if you'd like to know more about oral health and your overall health and how they're linked together, you can hop on over to holisticdentistry.au or check out my dental office website, evolvedental.com.au. So let's get into how to improve your oral health beyond brushing and flossing, and let's get in the zone. So as part of your personal home care program, you've got to brush your teeth and you've got to floss. You've got to do it well, and you've got to do it consistently. You've got to be methodical, and you've got to have a good technique, which I've gone through in the previous episode. But there are other things that you can do to improve your gum health and your mouth health, to heal your mouth, to reduce your risk of further disease, to prevent cavities, and help reduce your need for constant dental care. So one of those is water irrigation, or a water pick, or a water flosser. Now, I like water irrigators, but you need to be getting the right ones and you need to be using it properly. At first, it's a bit of a learning curve and it can get a little bit messy, so perseverance and practice. So who should use a water flosser? Well, basically anyone, or water irrigation or a water pick. Basically anyone who has gum disease, especially if you've had bone loss. Now, when you go to your dentist or your hygienist, they will be doing your pocket depth or your periodontal charting, and they'll be measuring the gaps between your gums and your teeth to see how deep they are and to check if you've got bone loss. So if you've had numbers that record 4 or higher, you've got bone loss. If you've never had your numbers recorded, then I want you to ask your dentist or your hygienist to do it. And if they're not doing it, then I would question actually how much they really genuinely care about your gum health and getting you back on track and making sure you don't have problems. Anyway, who should use it? So anyone who has gum disease, especially if there's been bone loss, it's a supplement to brushing and flossing, and you use the water irrigation. It's a great preventive device if you don't have gum disease, so I'm still a big fan of it. If you have gum disease, you should use it after you've brushed and flossed, and after your disease is healed, you use it at night after your last brushing and flossing. It's actually quite refreshing, and you might just want to use it any old time. I find it's really useful after you've had a meal, particularly something that's got a lot of strong flavors like garlic in it. Really, really good at refreshing your mouth. Now, how do you use it? Now, you can run it without water in the container, and this is a good way to do a practice run. You can see your technique in the mirror because you haven't got water going everywhere, and you can also get the sensation of how the tip of the oral irrigator feels next to your gums. You can't do this if water's squirting all over the place. It's just going to get really messy. You can't really get a visual and a handle on it. So read through the directions Listen to the directions here. So read through your directions on your irrigator and then listen to what I'm going to explain here and then run through the motions. So begin at your regular starting place and follow the same pattern as you do when you brush. So you're going to be starting on the inside, on the top right, working your way all the way around the inside in a big loop, coming back, working around the outside, and that's going to be your method with your water irrigator as well. So make 2 or 3 complete passes round your mouth to perfect the technique. Adjust the tip of the irrigator so that it touches the area of the tooth where the gum meets the tooth, which is a little bit like where your fingernail joins your nail bed. So that's where you want to be aiming the tip of your water irrigator. So you want to angle it at about 45 degrees to the tooth and make sure it's in direct contact with the gum line so that the jet of water will have access to go into the gum pocket. If you have bone loss and spaces between your teeth, make sure to move the tip between the teeth and direct the water into the pocket on the sides of the teeth. Make the adjustments to move around your teeth, so you might have to turn your head, tilt your head, move your hand, turn your wrist. Practice this, watch your movements in your mirror and tune into how it feels, because when the water is shooting, you're going to have to keep your lips closed so it doesn't go everywhere, and you're not going to be able to see what you're doing. Irrigating is definitely a technique that's going to rely on your sensory skills, your motor skills, and touch and feel. So the irrigation device, that's going to have your directions for use, and they're each going to have their unique features. So do make sure you read that and make sure you follow the directions. Now, how much time should you spend with your water irrigator? Well, the severity of the disease and the pocket depths on your periodontal chart, which I talked about earlier, will guide you to how much time you need to spend. You should spend extra time in any area that has a pocket depth greater than 3 millimeters. The deeper the pocket, the more time you're going to need to spend. You're going to slowly move from tooth to tooth, and when you get to a problem area, and you should have your periodontal chart printed out from your dentist or your hygienist, and you should then be able to map that onto the chart that you've made of your own teeth, which we covered in our oral self-exam. So you slowly move from tooth to tooth. When you get to a problem area, stay there for longer, move the tip back and forth along the gum line for 5 to 10 seconds, then move on. If an area is not healing, then you need to spend more time in each session until it responds. As you increase the pressure, the liquid will run out faster, and in order to finish the job, make sure that you're keeping an eye on the water level in your irrigator and make sure you top it back up. Now, there's going to be different settings for water pressure. The healthier the gums are, the higher you can adjust the pressure setting. If you have gum disease that's active, I want you to start always on the lowest setting. And then every sort of 3, 4, 5 days, you can move it up a notch unless you've got some spots that are still not healing. And then you're going to require that lower setting for a longer period. The only way you're going to do harm to your gums with the water irrigation is if you use too much water pressure before your gums have healed. So err on the side of caution and go have too little pressure to start with, and just be patient while you get used to it. Now, the liquid in your irrigator, you don't want that too hot, you don't want it too cold. You want it close to body temperature. And this is a must if you've had bone loss and you've got sensitive teeth or you've got sensitive teeth. Test the water, stick your finger in it, and if it feels kind of neutral, then that's going to be at body temperature. When it's at body temperature, you shouldn't actually be able to feel any difference at all. If you've got gum disease, you can use an antibacterial mouthwash or saltwater solution in your irrigation device. You can Put a little bit of 3% hydrogen peroxide in there as well, because that's very antibacterial. But check with your product instructions first to make sure that you're not going to damage your water irrigation or your water pick by using anything other than water. If you do find that you can only use water, then there are other ways of getting your mouthwash into your spaces afterwards. There are 4 ways to include your mouthwash or your salt solution in your irrigation program, and you can do it this way. You can fill the container half mouthwash, half water. You can fill the container with water, and then when you've used all the water, you can add a couple of centimetres or more of undiluted mouthwash just to finish off with. You can use straight mouthwash and just use that as a swoosh around rather than through your irrigator. If you can't use the mouthwash and you don't have a problem, then use the salt water mixture. It's very good for healing infection. It's very antibacterial. You can use half a teaspoon of salt to a full container of water, stir it well, and then you can use that. And then once you've been declared disease-free by your dentist or your hygienist, you can back off on the salt water and mouthwash if you want to. Using a straight mouthwash or a 50% mouthwash solution might be a little bit expensive, but it is more effective than salt water or plain water. The salt water is going to give you good results, but the sodium might be an issue for some people. Using only water is about half effective as adding salt or using the mouthwash, but it's still going to reduce plaque and gingivitis than not using the water irrigator. You want to keep your liquid in check. Point the irrigator tip at the sink, turn on the irrigator and let it run for a few seconds. This is going to get rid of any cold water that's been left in the system or any kind of old water that's been left in the system. Then what you want to do is shut it off, place the tip in your mouth next to the first tooth in your pattern, gently close your lips around the tip, and then turn on the motor. If you forget to close your mouth, the water's just going to spray all over the place. Lean over the sink, and then when the water builds up in your mouth, simply tilt closer to the sink, open your lips a little bit, and let the water run out. When the water has been released, close your mouth again and continue where you left off. When you do it this way, you won't have to shut off the irrigator each time you release the water, and you're going to quickly get the hang of this. It will be messy at first. Then you've got to clean your machine, use only water. If you use only water, you won't have to clean the irrigator. If you mix anything else, especially salt, always flush it out afterwards so your irrigation tip doesn't become clogged. Rinse out the container with fairly hot water, then add a few inches of water to the container, turn on the highest setting, and the water will run through faster and run all the water through the tip, and that's it, it's clean. So what about the different tips? Well, how do you decide which water irrigation that you should purchase? Well, basically you want to be looking at the size of the tip. You want one that offers you the smallest possible tip. If the diameter of the tip is small enough, you'll be able to gently insert it into the spaces and into the pockets. The further the liquid reaches into the pocket, the better the results will be. This is especially valuable and important if you've had pockets that measure 4 millimeters or deeper. Always use gentle pressure. Never force the tip beyond a comfortable location. Be careful because you could injure the gum tissue by forcing it into the pocket. It may be easier to gain access to a diseased pocket because the gum does not hold so tightly to the tooth. As it heals, it tightens up and grips around the tooth. So don't just keep thinking, oh, that had a 4 millimeter or that had a 5 millimeter and just ram the tip in there. You've got to adapt to how your gums are changing. I really think water picks, water irrigators are the way to go. Really, really beneficial. Don't have any shares in them, guys. So let's move on. Let's look at toothpicks. Now, I don't like wooden standard toothpicks that you get at restaurants. They're dangerous. They're not the way to go. There are different tools. And when I say here toothpicks, I am going to be referring to intraoral cleaning products, interdental, so things like TP sticks and Pixters. Now they can be like little brushes, or they can be made of a rubber type pick material, and they're probably the easiest dental tools to use because they've got the little handles, but like everything else, you can misuse them. The purpose of the pick or the interdental brush is to break up plaque formation on the teeth, to remove food particles, and massage and stimulate the gums in the gingival area where the gum and the tooth join. Think of a toothpick as a miniature toothbrush that specialises in cleaning and massaging the delicate and vulnerable space between the tooth and gum. For hard-to-reach areas like the insides of all the teeth and the outsides of the back teeth, the size of your fingers can make regular toothpicks difficult to use. So the ones that have the small handles make them much easier to control and will give you better results. So how are you going to use them? Well, you use it by holding it at about a 45-degree angle to the gum line, and you gently place it into the gaps. Don't force it into the pocket because you might injure the tissue. Practice positioning the pick on your front teeth and check yourself in the mirror. All you have to do is angle the pick and then move it into the area and do like a little circular motion. Start in the pattern, start at the back, work your way around, start and finish in the same place every time. And then you know you're going to clean every area. And then once you've done that, rinse your mouth well with water. If you're at home, use your oral irrigation, your water irrigator, because that's going to wash away any of the debris that you've just released and stirred up. If you do use a wooden toothpick, nibble on the point until you have blunted it and create a frayed brush-like end. This will keep you from accidentally puncturing and penetrating the skin with the point, and the frayed end acts like a miniature brush. If you use a plastic pick, watch out. Some of them have very sharp points, and you might want to, I know this sounds a bit odd, you might want to lightly sand the tip with some fine sandpaper until the point is no longer sharp. If you have periodontal disease, you can soak the end of your frayed toothpick in some mouthwash or hydrogen peroxide, the 3% solution, and not only will you mechanically dislodge the plaque, but you can also add your chemical germ fighters. So you can do that with your TP stick, you can do it with your Pixter, your interdental brush, your interdental pick. Get one of those handy toothpick holders, and you can always keep that with you. And then you can use that when you're out and about if you've had a meal, and if you can't brush or floss after eating, at least you can push the food out from in between your teeth. I've been a huge fan of dental picks and dental Pixters over the last few years while I've had braces on, because you can't floss. And they are just the best thing for getting in between your teeth. They were the best thing for getting around my brackets and wires. And now I have my braces off, I can floss and brush, use my water irrigator, use my picks, keep my gums nice and healthy. Now, how do you know if you're brushing and flossing and pixtering and picking in between the teeth and irrigating effectively? Well, you can look in the mirror and you can see whether you've got plaque or tartar buildup, but by then it's a bit late. You've already got the baddies there. The bacteria's already got a hold, and that's not going to deal with the microbiome. It's not going to deal with the biofilm. And one way you can check for that is what we call disclosing agents. Now, they stain any areas of plaque and biofilm that you haven't removed. They become as a liquid or a tablet form. They're going to have directions for use, but let me sort of explain how I like to do it. If you're in the process of learning your new hygiene techniques, it's almost like having your dentist or your hygienist come home with you so they can show you where you're cleaning well and where you're not. So if you use the tablets, let them dissolve in your mouth before you brush. And if you use the liquid, just swish it thoroughly around your teeth. Then you can use your mirror, have a look and check for stains that indicate where there's food, plaque and biofilm. Then go through your brushing pattern, take another look, then floss, take another look, take your water irrigator and have another look. You will see that each successive procedure has removed more of the stain, food and plaque. Using disclosing agents, I think, is one of the best ways to demonstrate the effects of proper oral hygiene technique, especially to your kids. During the early stages of formation, plaque is almost impossible to see, and it makes it difficult to get the hang of what you're doing. You know that, oh, well, out of sight, out of mind. If I can't see it, then it can't be there. And that's not the attitude that I want you to take when it comes to your oral hygiene. Once plaque is stained with a disclosing agent, and it stains very well, you've got your visual proof that it does exist and you can see where you need to work. So you don't have to do that every time you brush. You can use that, say, once a week while establishing your hygiene program to make sure that you're not missing any areas. And then I would say use it, every couple of weeks or once a month, just to keep yourself honest and on track. So what else can you do? You can use things like rinsing and gargling. Now, rinsing and gargling are not the same. They're not performed the same way, and they don't give the same results. So this is the rinse versus gargle experiment. Do it after you eat your most complete meal of the day. And then what I want you to do is brush, floss, and irrigate your mouth as you normally would. Then rinse with water, but don't gargle. You would think that after all these mouth cleaning procedures that all food particles would be washed away. Well, I'm always going to suggest there's probably a little area that you missed, or like me, you've got one spot that just likes to hold on to everything. Well, what I want you to do is make sure your sink is nice and clean. Then put the plug in, stop it up, take a small swig of water, tilt your head back and gargle real well, deep, high and long. You might need to experiment with the amount of water you need to gargle with to avoid your gag reflex. The head tilting is critical because it allows the water to sit further back in the throat, which is what distinguishes gargling from rinsing. Rinsing is just your mouth. Gargling, it's in your throat. Then what I want you to do is, get that water as far back down your throat as you can before doing your actual gargling. Practice and you will reach areas at the back of your throat you never thought you could manage. Spit the gargled water into the sink and take a look at what you found. What do you see? Yep, food. Because the back part of your mouth and the upper part of the throat can catch and lodge many of the foods that we eat. Foods that are especially troublesome are your mucus-forming foods such as dairy products, flour, and foods that you may be allergic to, and foods that contain sugar. It's possible that some of the food sticks to the palate and the upper throat, and it's going to get back onto your teeth and gums, and perhaps when you clear your throat or cough. So why put in all that effort with your oral hygiene if you've got food particles sitting at the back ready to come back in? There are other reasons to gargle after brushing. One is that when food particles, particularly dairy products and food containing sugar, start hanging at the back of your throat, they are going to provide super breeding grounds for all kinds of bacteria. And left there long enough, the bacteria are going to breed, and in large numbers, they can create enough irritation and infection to cause sore throats and tonsillitis. I think they're actually a contributing factor to strep throat. And then the lymphatic system that protects the upper part of your throat at the back of the mouth can be overwhelmed, and it can be weakened from constantly fighting off the bacteria and the irritation and the toxins they produce. Another reason to gargle is to get rid of excess bacteria and food particles is that by doing so, you reduce the risk of bad breath. So do your immune system, your throat, your teeth and gums, and your friends or your dog's nose a favour by adding both rinsing and gargling to your oral hygiene regime. If you can't brush and floss after eating, you should at least rinse and gargle. When you rinse, be sure to suck the water back and forth between the teeth, particularly if you've got bone loss. Wherever you've had bone loss or gum recession, there's going to be gaps around the teeth where your gums once lived, and that means that's a space where food can lodge. Passive rinsing will not reach the areas as well as forceful sucking in and out of the water will, and you've got to make sure that you're doing the best you can there, otherwise that bone loss is going to be a problem. So we've cleaned your teeth, we've flossed in between, we've water irrigated, we have cleaned the gums, we have gargled and rinsed. Now we need to clean the tongue. Look, if you're most people, you don't give your tongue much attention. It's a really spectacular organ made up of lots of muscles and sensory things. Without it, we wouldn't be able to talk, we wouldn't be able to swallow, we wouldn't be able to protect our airway, we wouldn't be able to taste very much either, because most of your taste buds are actually on your tongue. And if you've got a dirty tongue, your taste buds are clogged and you can't taste your food as well. It also reduces your sense of smell, because taste and sense of smell kind of go together. All right, so we need you to clean your tongue as much as your teeth need you to. So from a bacteria's point of view, your tongue is its favourite place to live. The taste buds are on there. They're like little trees that snag food, and they protect the germs from brushing, flossing, and rinsing. So you could be doing a super good job of cleaning your teeth and still have a high bacterial load in your mouth because your tongue is not being cleaned. Now, there's a couple of ways to clean your tongue. The first is to clean it with your toothbrush. Rinse your brush under warm water, stick out your tongue as far as you can, push your brush as far back on the tongue as you can manage without making yourself throw up and gag, and brush it from back to front. Now, I don't think that's as effective, but it's better than nothing. Sometimes if you can hold your tongue with your gauze strip, you can grasp the slippery tip of your tongue and it stops your tongue from kind of tucking back in and slipping away. Brush with as much pressure as you can tolerate, but don't abuse it. Don't shred your tongue, because there are thousands of sensitive taste buds residing there. So you stick your tongue out, put your brush back as far as you can, sweep from back to front, rinse your brush off over every time you go from back to front, and then go again and again over all the tongue. The second way you can do it is you can use a clean teaspoon. Now, I find that easier than the brush. So you can rinse your clean teaspoon under warm water, warming up to body temperature. Open your mouth, stick out your tongue, and place the spoon with the spoon side, not the curved side, down. So you've got the bit that you'll be scooping up food with, or whatever you're going to put on your teaspoon. And you put that as far back on your tongue again without gagging. Press the spoon against the tongue, drag it lightly toward the tip of your tongue. And if you look at the contents of that spoon, you're going to go, oh my God, look at that. Your tongue is one of your body's measuring sticks. The better the diet, the healthier you are, the cleaner your tongue is, and the cleaner your spoon or your tongue scraper is going to be. You might try both techniques, brush it first, and then do the spoon. Be gentle and clean as much of it as you can. There are tongue scrapers and tongue scraper products out there. They all work very well, but no need to buy one. Just use your teaspoon. Now, if you've got crowded teeth or misaligned teeth, there's going to be some extra things for you to do. Mouths that contain perfectly straight teeth with no decay and no periodontal disease are very rare. So most of us are going to have something going on, and so I'm going to pass on a few extra tips for managing these special problems that are often overlooked by your dentist and your hygienist. If you've got overlapping teeth, the areas where the teeth overlap are going to be more stained and junk-filled. than areas where your teeth are straight. If you don't believe me, look at your teeth after you've eaten some bread, nuts or seed, and you're going to see that you've got food stuck in these areas that are overlapped. These misaligned areas are going to probably have the most bleeding or the biggest pockets on your periodontal chart or the most plaque. And I bet you find your gums here are not as healthy as where your teeth are nice and straight. And this is one of the main reasons I encourage my patients to get orthodontic work, to have braces, because straighter teeth are easier to keep clean and look after. So most brushing techniques are designed for straight teeth, and in order to compensate for overlapping teeth, you've got to change the angle of your brush. You can't brush with the same up and down motion you use for other areas. If you don't compensate for the misalignment, you're not going to be able to effectively remove your food and plaque. So be creative with your brush and spend extra time in those areas. And then flossing, water irrigating, and picking are also a must. If you've got missing teeth, that's also going to create brushing problems. So you're going to have to pay special attention to the teeth on either side of the space left, but also the tooth above or below, because that no longer has a chewing partner and it becomes more vulnerable to decay and gum disease, because the natural self-cleansing process that is a byproduct of chewing no longer exists for that unopposed tooth. Until you get your missing tooth replaced, either use a small child-sized brush or one with a specialized head to clean around the teeth next to the empty space, and don't forget to floss and irrigate these areas. Now, margins, this is the term that we dentists use for the place where the filling joins your tooth, and it's easier than you think. It might be easier for you to think about margins as joins or seams. So wherever you've got a join between your filling and your tooth, you've got to know that this area is highly vulnerable to plaque formation and to decaying again. So your margins or your edges of your fillings are super important to keep clean. From a bacteria's perspective, that margin is like having the Grand Canyon. And germs can penetrate into a healthy tooth, and they can certainly get underneath where the filling and the tooth join. They can do this more easily if your filling doesn't fit tight or it has an overhang. So give this area special attention. Every tooth that has a filling, especially crowns, make sure that you keep them super clean. Now, here's an interesting fact, and the only thing that I can say that's positive about dental amalgam. Dental amalgam fillings are more resistant to re-decay at the margins because bacteria don't like mercury. But you're still going to need to clean those fillings really well. Now, why do bacteria not like mercury? Because mercury is toxic, guys. So if you have dental amalgams, you might want to go and listen to some of the other Dental Zone podcasts on dental amalgam and on mercury to see what I'm talking about. But for now, we're focusing on keeping your mouth clean. If you've got bridges in your mouth, then artificial teeth don't decay, but you've got to keep them clean because you're going to get plaque and tartar building up on them, and then that's going to spread more bacteria around your mouth. Well-constructed crowns and bridges, they're still going to be food and plaque traps, and they've got to be kept really clean. A bridge does not get cleaned by your natural chewing process, and if they're not properly cared for, plaque can form rapidly, tartar won't be far behind, and it won't be long for the plaque to reach the gums around the false tooth and cause irritation and inflammation. The plaque that forms on the bridge itself is also a breeding ground and food storage area for more germs, and it can contribute to decay, gum disease, and bad breath. The brush is not going to reach all the areas of the bridge, so you've got to use your floss threader to clean underneath, and your little brushes and your irrigation as well. Make sure you floss the sides of the natural teeth next to your bridge. and get in underneath it and use your water irrigator to rinse the stuff you've loosened and to massage the gums underneath the actual false tooth of the bridge. Now, you might have removable dental. Let me just go back a second as well. This is also critical if you've got implants. Implants will trap food and plaque, and you can get what's called implantitis, which is infection of the gum around the implant and infection of the bone that holds your implant in. So you've got to keep areas around your implants super, super, super clean. And this is why patients who have implants should be seeing their hygienist or dentist every 3 months for gum care. So if you've got part dentures, if you don't take care of them, they are going to become very, very, very dirty. You've got to pay special attention to where the partial denture attaches and sits on or next to your natural teeth. Those teeth are called abutments, and they undergo a great deal of stress. There are major food and plaque traps in those areas. They are so important, you should consciously hone in on them and give them as much time and care as you can to keep them healthy. We see so many patients who get decay and gum disease on the teeth where their dentures sit onto or next to because they just don't keep them clean enough. We're always going to let you know how you're going with that. Also, wash your freaking denture after you've eaten, guys. Don't let food build up on it or underneath it. I cannot tell you how gross it is when a patient comes in and we pop their part denture out and it looks like there's 10 weeks of rancid food underneath there. And I show it to them. I scrape the tartar and food and plaque off and I make them look at it and smell it, and they go, "Oh my God, Rachel, that's disgusting." And I'm like, yes, that's been in your mouth. Clean your denture. Brush it, wash it under the tap, put it in some mouth rinse, bit of hydrogen peroxide, denture cleaning solution, clean your denture. If you don't look after your denture, the teeth that hold it in start to fail. They decay, they rot out, they snap off, they get extracted, you lose them because of gum disease, and then your denture has to be added to or remade, and that's more expense. Now, even if you don't have natural teeth and you've only got complete dentures, you've still got to clean them. They still get stained, they still have plaque and tartar build up on them. They're still going to have bacteria and germs. And again, it's going to make your mouth funky. It's going to make it smell. It's going to make it unhealthy. It's going to stress your immune system, your tonsils, sore throats. And you can get yeast infections and all sorts of nasties going on. Now, I've talked about braces a little bit earlier. So if you've got orthodontics, you've got to keep them super, super clean. They're germ and plaque traps. You must spend extra time brushing around the areas where your braces are attached. And this is also applicable if you're having clear aligners like Invisalign and you've got bonded attachments on. Got to keep those areas super, super clean. Spend extra time where your braces are attached. Brush and irrigate both the top and bottom portions of the braces. This is where I'm talking about fixed braces. Think of braces like your gingival crevice and use that same little shimmy motion and you'll get them nice and clean. Because you can't floss when you've got traditional braces on, you've got to make up for that with extra brushing, picksters, toothpicks and water irrigation. When you use the irrigator, make sure that you direct the jet of water from the top down and from the bottom up. Electric toothbrushes are great if you've got braces, and don't eat foods that germs love. Instead, eat raw veggies and fruit instead of soft, processed and refined stuff that's just going to get stuck everywhere. If you do have limited hand function and mobility, then an electric toothbrush is really fantastic. Sometimes you're going to have to get a friend or your loved one to help you with your dental care. To really make sure that helps. So if you do have like arthritis, limited ability with your hands, then your electric toothbrusher. your electric toothbrush, your water irrigator, and your floss holders are going to be really, really valuable. But you've got to pay more attention to your diet because that's your best tool. Avoid sugar, use mouthwash, finish meals with something like a carrot or an apple, and then you've got to see your dental hygienist more regularly. That's just going to be the way it is. You can use a mixture of hydrogen peroxide with some baking soda, quarter of a teaspoon of each in half a cup of warm water. And then after you've done your normal brushing and cleaning, mouth rinsing, gargling, mouth washing routine, you can then dip your toothbrush in that solution, brush around your mouth again. That's going to neutralize acids. It's going to produce oxygen, which kill the nasty bacteria. You can then swoosh that around your mouth as a mouth rinse, and that's going to help reduce your risk for tooth decay and gum disease. So it's really important that you take care of your mouth, teeth and gums. I was very lucky, even though, my parents weren't dentists and I didn't floss as a kid. I didn't know what that was. Wasn't raised with that, but I was raised on a low sugar diet. Very, very fastidious about having to go brush our teeth, do it properly, regular dental checks. And I am very thankful for that because I have really healthy mouth and healthy gums and have never really had any problems. But it's hard to change old habits. I don't like flossing, guys. Even though I know how important it is, I find it irritating, I find it fiddly, but I still do it. This is why I like the water irrigator and I like the Pixers, because they make up for those things that I'm not so good at. I can floss your teeth really well because they're your teeth and I don't have to put my fingers in my mouth and be at all the awkward angles, but I want you to persevere. You've got to be very willing to change your unproductive habits. So things that have really helped me to establish new hygiene habits is just to really be willing to give them a try. So master the basics first and then try adding some variety into your program. It's a little bit like exercising. You're going to get stale if you just do the same routine. You might find that it's fun to kind of do a little bit of stretching, a little bit of, marching on the spot, play some music that you like, get creative. And this way you're going to get rid of your decay, you're going to find it interesting, and you're going to get your oral hygiene done. So just find ways of doing it that make it fun. Now, some people brush and floss in the shower, and I go, yeah, you can, but you know what? I don't think it's very effective. Don't use your toothpaste if you're brushing in the shower. But also, I think it's a bit of a waste of water. But you can probably, if that's for you, then do it. But I don't think it's the best way. I want you to keep track of how your mouth is looking because that's going to be very motivating. So you do oral exam, make a note, are your gums improving? Are they looking healthier? Are you getting less bleeding? And then when you go to your dentist or your hygienist, get them to report back to you because I think if you've got some feedback about how you're doing, then you're going to get better with it. Like the few minutes that you're going to take each day improving how to brush and floss, then it's going to be worth it if it saves you money and pain and suffering and improves your health. Now, what you're going to do if you're away from home, then take your floss and your picks with you, take your bits and pieces with you. You might not be able to carry your toothbrush around, but if you've had lunch out somewhere, you can go to the bathroom and you can do a quick in between your teeth. If you feel embarrassed to do that, then at least rinse your mouth with some water. I usually carry some Pixters and some floss in my bag. I usually have a little travel toothbrush as well. At work, obviously I'm a dentist, so I have my toothbrush and toothpaste, but you can do that as well. There are lots of ways that you can take care of your mouth. I don't want you to find it to be a struggle. I want you to experiment with my suggestions. You'll find that with time that it gets easier and it's not so tedious. It's not so much of a chore. And as your mouth gets healthier, you'll find you don't have to spend so much time brushing and flossing. Yes, if you've got bone loss, you're going to always have to be very, very diligent. Take care of your mouth. It's just shifting that mindset. Do it because you want to take care of you. Do it because you want to have good overall health. Do it because you want to have a long, healthy life. Don't do it because you feel forced to. If you don't want to keep your teeth, fine, don't. But then don't moan and complain when your hygienist or your dentist says your gum disease got worse and you're going to lose a tooth. So you're going to establish a hygiene pattern. You're going to brush after every meal if possible, but definitely morning and evening. You're going to floss after every brushing. And whenever else, make sure you definitely floss before you go to bed. You're going to rinse and gargle after brushing and flossing and after every meal, especially if you can't brush and floss. You're going to choose some sugarless gum if you can't brush after eating, especially foods that contain sugar. You're going to irrigate with your water irrigator after your last brushing and flossing of the day. You're going to use your picks anytime, but especially after eating when you can't brush, and clean your tongue every day. Then you're going to have to make sure you work with your dentist and your hygienist and get them to help you have a healthy mouth and have healthy gums and a healthy smile for life. And I'll talk more about that in the next episode. So I hope you found some of these things educational, enlightening, and they may help you join the dots as to why your oral hygiene's not improving, why it is every time you see the dentist you seem to have a cavity, why it is every time they tell you your gums are still bleeding or you've noticed your gums are still bleeding. So thank you very much for listening. I'm Dr. Rachel Hall. This is the Dental Zone. If you'd like to know more, hop on over to holisticdentistry.au or check out evolvedental.com.au. If you live in the Brisbane area or you're willing to travel, as a lot of my patients do, then please give our office a call, 0737 201811, and you get to come see me in person and I can help you with your holistic dental health care needs. Until next time, stay in the zone and do share about this podcast with your friends and colleagues. Post it onto social media. If you're listening on Apple Podcasts, then do me a favor and leave us a review because that helps the podcast get some rankings. If there are topics or subjects that you would like me to cover that I haven't done so far, then you can either put that in the comments because you can do that on YouTube, or you can email info@holisticdentistry.au. Thank you so much. This is the Dental Zone. This is the podcast that is teaching you how to improve your oral and overall health through your dental care. Until next time, everyone, yes, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.